Hi, my name is John Consalvi, and I'm the CEO of LinguaHealth and Grupo Lingua. Today I have Elizabeth Steffen, an experienced speech-language pathologist here, talking to us about issues in speech-language pathology that are relevant for clinicians that are running and creating programs in hospital settings. Elizabeth, thanks for coming.
Thank you for having me, John.
Elizabeth, from your experience, how would you develop and grow a medical speech-language pathology program?
The first thing that I would do is to make sure that you have strong clinical skills, that you are able to provide the best care through evaluation techniques and diagnostics, all the way through developing an individualized therapy program and plan for your patients. Once you're strong clinically and you have that experience behind you, it's about establishing the relationships not only with the patient's family and their friends, but also to make sure that you're able to establish relationships with other providers on the medical care team, such as the nurses, the techs, the doctors, the respiratory therapists. All of those people play a crucial part in the recovery of a patient for stroke or brain injury, for example. So once you've established a great relationship and great care with the patient and family, then you can make sure that you have the doctors on your side. And it's just about establishing and continuing to maintain those relationships. From there, word gets out that you're able to provide great care. And another thing that you can do is to make sure that you're out there in the community in different associations, working through ASHA or ISHA, Brain Injury Association of Illinois. Any of those are great organizations just to get your face out there, talking with other professionals on the care team. And then the word kind of spreads by word of mouth. I think that's the fastest. And then you have posters and flyers and making sure you just have that strong presence.
So Elizabeth, you've worked in hospital for several years now, and you've seen parents come in to your program and they might have a child that had a traumatic brain injury or a loved one that needs services from a speech-language pathologist. It can be quite confusing at times. What could you say to them to help them navigate through this system and this process?
Navigating the healthcare system is challenging at any point in the system. The best thing to do is to make sure that you establish that trust from the beginning. You let them know exactly where the patient is at, either family member or friend, in that evaluation. Okay, so this is what I'm recommending, this is how I see you progressing through the therapy program, and I will make sure that you're well informed throughout the way. And if they're not able to actually be present in the therapy session, to make sure that you follow up by phone call. You say, this is how the therapy session went. This is how your child is progressing. Is there anything else that I can do to help you? And making sure you just have that open dialogue. If they're comfortable in approaching you and asking you questions, then you can definitely be a resource for that person. It's just making sure that from the beginning of that relationship, on that first visit, that you have their trust and that they're comfortable and willing to talk to you about questions and concerns as they come up.
Well, thank you very much, Elizabeth. It's been a pleasure.
Thank you.